Most of the time we get complaints from these women using the depo-provera injection as a contraceptive method with complaints like, "Nurse, since I started using the depo-provera, I'm no longer receiving my periods." Some comes with complaints like, "I'm receiving it in excess," and others also come with complaints like, "Okay, I stopped using it, but I've not conceived. What can be the problem?" This draws my attention to today's video about the depo-provera, this injection. Welcome back to the Nursing Moms. I'm Nurse Janet, and I do videos about pregnancy, labor and delivery, family planning, any other nursing talk, health education. So if you've got interest in such like videos, kindly hit the subscription button so that you may not miss in any of my videos. In this video here today, I'm going to talk about the depo-provera in details, when you should use the depo-provera, how the depo-provera works, what are the unwanted effects, and who should use the depo-provera. Depo-provera is an hormonal contraceptive. When I say hormonal, it means it contains hormone. Specifically, depo-provera contains a hormone known as progesterone-only hormone. And this progesterone-only hormone works by delaying an ovulation. So that is how specifically the depo-provera works. This is an injection that you always get after every 12 weeks, that is 3 months. So you have to keep track if you are using the depo-provera not to miss on any other single date, because after every 12 weeks, that single shot would have worn in your body. I've said how it works. It works by delaying or preventing an ovulation. And what are the benefits of using a depo-provera compared to other methods of contraceptive? One very good reason for using a depo-provera is that it's secretive. You won't, like, no one will know that you've been injected. That's one good reason. Another one, it reduces the menstrual flow. If you are a heavy bleeder, remember depo-provera has this common side effect of kupotea na menses. You will be getting your injection, but you will not be receiving your regular periods. I think that is to the benefit of it, because there'll be a reduced amount of flow. Another important thing or another benefit is that it reduces cramping. While using depo-provera, you might experience very mild cramp if you had severe cramps previously. And it doesn't require daily action like taking to remember, like you are taking the daily pills. That is another good advantage of using the depo-provera. And again, you have 3 months of freely enjoying sex without an interruption, like today, maybe yesterday you didn't take this, that. Now let's move to the unwanted effects of using the depo-provera. Medically, we call them the side effects. You are using this drug for this kind of reason, but there is something that is not going on smoothly while you are using the depo-provera. The beautiful part of it, of these side effects, is that like after 2 to 3 months, your body will adjust and you will experience them very less or no at all. That is the beauty of these side effects of using depo-provera. The number one effect is changes in your menstrual bleeding. The changes can be spotting, you can have intramenstrual bleeding, or you cannot see your periods at all. Spotting is that kadogo yenye kanachafua tu siruaru, but it's not something to have the sanitary towel for, maybe a panty liner. But okay, it's irritating because every now and then you will be washing blood. Intramenstrual bleeding is that where you will be, okay, you had your 28-day cycle, but again, this after 2 weeks, you've received another 1 week. That is what we call intramenstrual bleeding. It's now not going the way it was. This cycle is not yet over, but again, you've received your menses. The last change in your menses will be not seeing your blood for some times, medically known as amenorrhea. This is just very normal while using the depo-provera as a contraceptive method, because ideally this is how it works. It works by preventing ovulation. Another important unwanted effect of the depo provera that I really wanted to talk about is the delayed return to fertility. Yeah, you've heard these confessions that since I stopped using the depo provera, I've not conceived. And again, you've seen women who missed it within 2 weeks or 1 month and she conceived. This first tells you that our bodies are different, and yes, depo has that common side effect of delayed return to fertility. Delayed return to fertility is a situation where after stopping the use of depo provera, maybe you got your last shot like 3 to 6 months back, but you've not yet conceived. It is common and it is normal while using the depo provera injection as a form of contraceptive. This can take few to even 10 months after stopping, but later it will come. You will resume your fertility. It's not a permanent, it's not like an infertility setting in, unless there is some underlying conditions, but stopping the use of depo provera cannot render you infertile. Later you will resume your fertility back, but it can take time. The fact is that it can take some time, few weeks to months. So depo provera and your libido. What is the impact of depo provera on your sexual urge? Depo provera is a high dose of progestin hormone, and progestin hormone inhibits the release of estrogen hormone, a hormone that plays a very important role in your sexuality. So there is high chances that while using the depo provera injection as a contraceptive, your sexual urge may decrease. Some women can have changes like having headache, the sore breast, the sensitive breast, but remember these things will always adjust. This can only happen in the first 1 to 2 months after starting the use of depo provera. Later, as you continue to use this kind of contraceptive, your body will adjust and you will not be experiencing this headache, sore breast. If you are experiencing this in your 9th month of using depo provera, then there is a problem. You need to go for further investigations. Other changes is changes in your weight. Again, you have to remember that we are different. Some women can have weight gain, some can have weight loss. It is normal. And thank you for watching, and remember, the benefits of preventing unwanted pregnancy outweighs these side effects. The side effects is just a matter of time and your body gets adjusted to it. But remember, unwanted pregnancy can. Thank you.